हेलो फ्रेंड्स, नमस्कार, सत श्री अकाल, सलाम वालेकुम। आज फिर आपका अपना कार्डियोलॉजिस्ट फिजिशियन डॉक्टर कपूर आपके साथ है। वंस अगेन आई एम विद यू। मैं ਤੁਹਾਡੇ ਨਾਲ फिर आ गया अपनी लोगों ਦੇ ਨਾਲ just to discuss about heart as usual, being a heart doctor. Now, we always come across heart issues day to day as a doctor, but layman ਇੱਕ ਨੋਰਮਲ ਪਰਸਨ ਨੂੰ ਨਹੀਂ ਪਤਾ ਕਿ ਕੀ ਹੁੰਦਾ ਹੈ ਹਾਰਟ ਪ੍ਰੋਬਲਮ, ਕੀ ਹੁੰਦੀ ਹਾਰਟ ਅਟੈਕ, ਉਹ ਜਾਨਲੇਵਾ ਹੋ ਸਕਦੀ ਨਹੀਂ ਹੋ ਸਕਦੀ। ਦੀ ਸਟੈਟਿਸਟਿਕਸ ਇਜ਼ ਵੈਰੀ ਸਕੇਰੀ। 18 ਮਿਲੀਅਨ ਲੋਕ ਪੂਰੀ ਦੁਨੀਆ ਵਿੱਚ ਹਾਰਟ ਅਟੈਕ ਨਾਲ ਨੂੰ ਪਿਆਰੇ ਹੋ ਜਾਂਦੇ ਨੇ ਐਵਰੀ ਈਅਰ, ਵਿਚ ਇਜ਼ ਅ ਵੈਰੀ ਬਿਗ ਨੰਬਰ। ਇਟਸ ਵਨ ਆਫ ਦ ਮੋਸਟ ਕਾਮਨ ਕਾਜ਼ ਆਫ ਮੋਰਟੈਲਿਟੀ ਡੈਥ ਇਨ ਦ ਵਰਲਡ। ਹਾਲਾਂਕਿ ਕੋਵਿਡ ਦਾ ਬੜਾ ਸ਼ੋਰ ਸੀ, ਐਵਰੀਥਿੰਗ ਇਜ਼ being said कि the COVID, the whole civilization, the population, a lot of population may vanish. 3 साल हो गए ने कोविड में, about 6 million people of course lost life, many people got affected. It was very bad. We don't want to lose even a single life, and that was the reason that so much was done for the COVID. But in that process, what happened, the heart issue which has been there with us for long time took a second stage, backstage. उन्हें उतनी इम्पोर्टेंस नहीं मिल पाई, although the death rate, mortality in heart disease is much more. People were reluctant to go to the hospital, the beds were not available, the ambulance service was not there, the doctors themselves were busy with COVID and other organizational activity to give the best immunization, vaccination that was required. There was a need of the time, but in this process, the scare factor kept the heart patients away. And that is the reason we get a lot of heart patients now. As a sequelae of long COVID also we get heart patient. So I want to give you an idea about what are the early signs of heart disease. Let's start from the beginning. In fact, heart disease, heart attack है बड़ा common discussion the point जरूर होता है, लेकिन people should know what are the early signs. At this stage, if you take action, probably you don't land up with all those surgeries and heart-related stentings and angioplasty. So this is always our aim. Prevention is better than cure. So heart disease, the early signs which I always include, you should look for the risk factors. Kehde risk factors ne, kehdiyan indiya cheezaं ne, conditions ne which can bring heart disease in the long term. ਸਭ ਤੋਂ ਪਹਿਲੇ ਕਿਸ ਘਰ ਵਿੱਚ ਪੈਦਾ ਹੋਏ? What is your genetic history? What is your family history? Your father and mother has been living for 60 years, 70, 80, 90 years. Your grandfather had a lovely life of 100 years. Same grandmother, genetic factor is probably not there. Of course, this is one of the main genetic factors. The early premature heart disease at the age of 30, 40, 50 or before 60 is called as premature heart disease, and this is a positive family history. तो खुद ही अपना नंबरिंग स्कोरिंग कर सकते हो ਤੁਸੀਂ कि भाई हार्ट डिजीज फैमिली ਵਿੱਚ है कि नहीं। अर्ली साइंस ਦੀ ਮੈਂ डिस्कशन कर रहे हैं कि how you will know that you have the propensity to go into heart issues. So accordingly the action we'll start taking at an early stage rather than waiting for the disease, the heart attack to occur and then going to the doctor for the management. The first and foremost is genetic family history, positive or negative. Clear cut answer you can yourself give. Then, how's your lifestyle? Are you a sedentary person or you are an active person? What's your lifestyle from day to night? Always sitting, couch potato, sitting on the computer, hardly any exercise is another risk factor. And they equally on then you start gaining weight. Your lifestyle is not good. You eat, you work on computer. You eat, work on computer. Nothing more. No physical. The weight gain. Obesity is itself. Your BMI should be always less than 25. Make sure it's always less than. So that's a simple formula. You go in the computer, calculate by your height and weight, and you know your BMI is good. So तीसरा factor हो गया obesity. The food you eat, you always indulging in a lot of butter, cheese, ghee, red meats. Another risk factor. Then once we are working on computer, you start smoking. Smoking like an engine, smoking like anything, what even chain smokers, young age, smoking, sedentary lifestyle, another risk factor. Early sign I should call them. तो फैमिली हिस्ट्री हो गई, सीडेंटरी लाइफस्टाइल हो गई, ओबिसिटी हो गया, स्मोकिंग हो गई। ਉਹਦੇ ਬਾਅਦ ਪਤਾ ਲੱਗਿਆ ਕਿ फैमिली ਵਿੱਚ डायबिटीज है, साडा भी इंपेयर्ड ग्लूकोज टॉलरेंस हो गया, शुगर हो गया, हाइपरटेंशन हो गया, हैवी ड्रिंकिंग। So these are all risk factors which should be taken or mimicked as the early signs of heart disease. If you have multiple factors like diabetes भी है, hypertension भी है, cholesterol भी है, another risk factor to be very frank, and you have all the other things which I just mentioned, then it should be taken as a early signs and should be managed very aggressively. More the risk factors, more the aggressive management. We are talking about prevention. Prevention is always better than cure is a dictum everybody knows. तो prevent करना है। immunization क्यों लगवांदे हो, वैक्सीन क्यों लगवांदे हो, ताकि डिजीज आए ना। एंड जी तुसी 7-8-10 फैक्टर्स ਨੂੰ कंट्रोल क्यों करदे हो कि हार्ट डिजीज जब 40-45-35 ਦੇ ਉੱਤੇ ਹੋ ਤੇ ਨਾ ਹੈ। तो ਇਹ सब चीज़ों वास्ते you have to understand that you have to do this calculation yourself, scoring yourself तो कितनी risk factor है उन्होंने calculate कर लो। And that is the reason I advise everybody to visit doctor once a year at least to check your blood sugar level, check your cholesterol level, check your blood pressure, vitals. Maybe the doctor thinks he can do an ECG. So this is a important aspect of your annual program. You should have a resolution the new year कि once a year you have to do the checkup where you will know exactly where you stand in the risk factors and accordingly the management will be done so that you don't have to go for aggressive surgical or interventional programs in the long term. मेरी सब ਨੂੰ ਗੁਜ਼ਾਰਿਸ਼ ਹੈ ਹੈ ਮੇਰੇ ਦੋਸਤਾਂ ਨੂੰ ਕਿ ਆਫ ਕੋਰਸ ਸਾਡਾ ਵੀਡੀਓ ਲਾਈਕ ਕਰੋ, ਇਹਨੂੰ सब्सक्राइब करो, साडे YouTube चैनल में सब्सक्राइब करो। Our only purpose is to make you healthy, see you living long and with great and good health. Share it with your friends on the Facebook also and spread the information what I have just said to your friends verbally also, so that once a year, once they do checkup, they know where they stand. If everything is okay, we are very happy. If anything has to be done, we will intervene in the early stages rather than waiting for a longer time and waiting for the fire to be on you. So please, in the end, once again, keep yourself healthy, think healthy, and spread health all around you. Thank you so much. God bless you. Namaskar.